Hi, I'm Mike Tierney of Data Not Distress, and in this FAQ, I'd like to answer the question, does Japan prove that COVID-19 was a pandemic of hospitals and not viruses? Japan is one of the wealthiest countries in the world, with a population of 125 million and the world's largest percentage of elderly persons at 41% of their population. Japan has modern hospitals and medicine and all the money they need for testing and treatment for their people. But unlike many other wealthy countries in the West, the Japanese government has complete control of their healthcare facilities and can order them to follow any standards deemed necessary. In February 2020, at the start of the COVID-19 pandemic, Japan gave their hospitals orders to require minimum standards for any admissions due to airborne disease. Any patients admitted to Japanese hospitals during the COVID-19 pandemic must have experienced all of the following for 4 days or 2 days for the elderly or persons with chronic conditions. Number 1, a 37.5 degrees Celsius or 99.5 Fahrenheit fever. 2, extreme fatigue. And 3, breathing difficulties. Anyone not meeting these standards would be turned away at the door and sent home to recover. These basic triage standards kept Japanese hospitals from being overwhelmed with patients, thus protecting those truly vulnerable to airborne disease, the elderly and otherwise weak. COVID-19, the same virus that has resulted in orders of magnitude more deaths in other countries, has only caused 30% of a normal year's cold season deaths in Japan. They've largely maintained a low number of deaths per case, and so now what has happened is that Japan has cases like any other country, but those cases have not resulted in a substantial rise in deaths, with only as many as 260 per day on as many as 7,855 daily cases, for a total of 13,140 deaths, or 10 per 100,000 of their population. Compare that to the United States, with just over 2.5 times Japan's population, where as many as 5,369 have died per day on as many as 274,627 daily cases, for a total of 561,818 deaths, or 169 per 100,000 of their population. As of May 1st, 2021, 91% of United States COVID-19 deaths occurred in a medical care facility, with only about 50,000 occurring outside a hospital, comparable to a normal cold and flu season in the US at 57,000. It is possible that if US healthcare facilities were required to institute policies like Japan's, to turn away patients in order to maintain their populations at manageable levels at all times, that the US could have experienced a COVID-19 death rate as low as Japan's. The data shows the result of different countries with different policies, and that data shows that protecting the elderly and thus existing hospital populations is one of the best strategies to minimize deaths to airborne disease and to experience normal cold and flu seasons. To not properly triage and turn away prospective patients for not meeting whatever standards are necessary to keep the hospital population within its capacity is deadly malpractice.